doing a head-to-toe physical assessment on you. It should take us about 20 minutes. Before we get started, can you tell me your name and your date of birth? All right, George Jackson, 12/24/1948. Okay. All right, Mr. Jackson. So the purpose of this is to just take a look and see how you're doing. Help us to get a general outline of where your health is right now. It's raising the bed up to a comfortable working height for myself. I'm going to be listening with my stethoscope. I'm going to be inspecting by looking and looking at your skin. I'm going to be using my hands to palpate and just feel and make sure that see how things are doing. All right. So the first thing, can you tell me where you are? And I'm at Bellarmine Nursing School. Okay. And can you tell me about what time it is? About 4:30. Okay. And do you know why you're here? Because you hurt your ankle. Okay. Really good. So the first thing I'm going to do is I'm just going to get a general survey. I'm just take a look at you, look at your face. Really good. All right. And I'm going to go ahead and do your vital signs, okay? So I'm going to do your respirations and pulse and blood pressure. So start off with your pulse. All right, and I got 40 beats per minute for your pulse. I'm going to go ahead and do that blood pressure. And I got 128/80. All right, now I'm going to listen to your breath sounds, count your respiration rate. I got 16 breaths per minute per your respiratory rate. All right, good. All righty. So I just want to ask, do you have any pain right now? And can you rate that on a scale of 1 to 10? 10 being the highest, 1 being, or 0 being no pain, 10 being the most pain you've ever experienced? Okay. All right. Okay. All right.
On the heart rate, what did you say on the heart rate?
On the heart rate, I said 80, I think.
You said 40.
Did I say 40? I don't remember what I said.
Okay.
Sorry.
I got it on video. It's on video.
Okay. So I'm just going to compare your pulses. All right, good. Both feel equal bilaterally, and they both feel strong, so I'd say 2 is expected. All right. I'm going to go ahead and listen to your breath sounds right now. So before I was just listening to you breathe, counting the number. Now I'm going to actually listen. Okay. All right, and I'd say the breathing sounds good. I'd say it's deep. I'm going to listen to the heart sounds now. And I'm paying attention to that apical pulse. And I don't hear any adventitious heart sounds or any adventitious lung sounds. I do need to listen to the back. So I would roll my patient over. I don't know if I can do that with a mannequin. Can you?
Just
Can I
verbalize it.
Just verbal. Okay, so yeah, I would roll them over. I would listen to the lung sounds. I would go on my pattern down, but I would also make sure that I listen posteriorly on the sides of the lungs to make sure I can hear the lung bases. So do that. Alrighty. Next, I'm going to assess the strength, and I'm going to look at his upper extremity strength. And so I would have him squeeze both my arms at the same time to make sure that it was equal strength, and it feels equal. So that's good. All right. Next, I'm going to go ahead and I'm going to look at the skin, and to test his hearing, I would turn away and just ask him, like, can you unbutton the side of your gown for me? Something like that. And if he could hear me, that would give me a good indication of him being able to hear the sound. All right, so now I'm going to go ahead, I'm going to take a look at your skin. And up here on the top of the skin, I see that it's warm, or the skin feels warm, and it's pink, and it's uniform in color, and I don't note any lesions or abnormal spots on him. I would also ask him to lean forwards, and while I was doing the breath sounds or lung sounds, I would be looking at the skin and making sure I look at the buttocks to make sure that there aren't any signs or abnormal skin breakdown. And so no breakdown is noted. All right. So now I'm going to be looking at your abdomen. Oh, I need to look at your eyes. I almost forgot that. So let me put this back down. Okay. So I use my pen light, and his eyes would be open and go like this. And I would check to see if the pupils are equal and round and accommodating to light. And then check for accommodation. I would have him, here's my finger, I'd have him look at like the wall over there and then look back and watch for accommodation. So yeah, that all looks good. Okay, so now we're ready to look at your abdomen. I've also been noting, doing a general survey, being sure to look for any signs of distress, not just in asking about pain, but just watching how my actions and what I'm doing, how he responds to the stimulus I'm giving, and right now I don't see any signs of him being in any type of distress. Okay, so I'm going to first auscultate the abdomen. I'm also just inspecting and I'm noting the color, and I would say that the contour is flat and it's also pink. And I'll find out the temperature in a minute, but I'm going to go ahead and auscultate for the bowel sounds. Listening in all 4 quadrants. All right, and I heard bowel sounds in all 4 quadrants. Okay, now I'm going to go ahead and palpate. I'm going to do a light palpation first. And if you are feeling, Mr. Jackson, if you're feeling any sort of pain or discomfort, please let me know if any area causes pain. So I did light palpation. Now I'm going to go a little deeper. Okay, and no pain, so that's good. Alrighty. So now I'm going to go ahead and move down to his lower extremities. Let's go down here. So the very first thing I'm going to do is I'm going to feel for the pedal pulses and see if they're equal and bilateral, and I'd say they are. And of course the posterior tibial pulses. Okay, I'm going to be checking for looking at the skin, but I'm also looking for any signs of edema on the skin. And I see that there is 2+ non-pitting edema on his right calf here, and it's tender to my palpation, so I'm going to be really gentle, but there's no varicosities. He does have leg hair, and I see that the edema makes his right leg about 4 centimeters larger, so it's 40 centimeters around, whereas his left calf is 30 centimeters around. Leg hair as well, and the color is a pink, no varicosities. I'm also going to just look at up here, and look at the skin. I'm going to look underneath the legs. Make sure I get to look at everything under the feet and heels. Alright, and the pulses are bilateral. So everything looks good there. Now I'm going to just assess the strength. I'm going to ask him if he could lift his leg. Good. You lift your leg. Good. Now his right leg is tender, and that's where the injury is, so I would assume that there's decreased strength. And it doesn't say. Oh, also his temperature was 98.6. It was down here, so I didn't know. And his pulses are equal, which I've already said before. So that skin looks good as well. Now I just need to remember if there's anything I've forgotten. Mr. Jackson, do you have any questions for me? Alright, no? Alrighty, well, I believe that concludes the rest of our examination. Please let me know if, oh, I forgot to ask, do you need any assistance when walking? You need crutches? Okay. And do you need any assistance with going to the bathroom, eating, performing self-care? No, you don't need any help? Okay. So that's good. We know your activity orders there. Good, good, good. And I'm going to go ahead and lower the bed. Make sure that you're back in a comfortable position. And your call light is in place. So you just call me if you need anything or if you have any questions. Okay, so now just think. And like I said, I wasn't able to turn him, but I would, be looking at his backside to make sure that I assessed all the skin. And that's it. All right, Mr. Jackson, thanks so much. Sorry.